Health News tonight. Nationwide, there's a growing number of free healthcare clinics that are turning patients away.
And while that's not the case here in Connecticut, News 8 health reporter Jocelyn Momenta is on the scene with how one area organization is dealing with the increasing number of patients.
Free healthcare clinics like this one are seeing a dramatic increase in the number of eligible patients coming in. And how to continue to serve them is a tough balancing act.
Long-term diabetic Rogers France.
I never did. I never thought that I'd have to come to a clinic like this.
And John Dawson with a family history of heart disease.
You know, I find it to be a blessing.
Are the new faces of patients getting free medical care. This is the Weissman AmeriCare's free clinic of Bridgeport, where due to a tight economy, the staff has seen a 50% increase of patients over the last 3 years.
Some patients happily have gone on to get jobs and we've lost them, but it's definitely fully subscribed. You know, the 3 days that this clinic is open seeing patients, it's always very busy.
For unemployed patients like Rogers and John, this clinic is a lifeline.
I wouldn't have been able to afford anything because of the workers' comp, and you know, you get that, but that's not enough for insurance when you have other bills have to be paid.
I would have gone off regular medications because I didn't have a doctor to do prescriptions for me. I would have run out of insulin at some point.
Nationally, nearly 90% of free clinics are treating more of the uninsured and low income. More than half are turning people away. That's according to a study commissioned by AmeriCare's, trying to balance resources of 3 healthcare clinics with the needs of the community.
The needs are great. We could be open many more hours, but the resources in terms of the medical staff, volunteers and paid staff restrict the amount of time that you can be open.
Karen Gottlieb with AmeriCare says the situation is critical and only expects it to get worse. Free clinics are mostly privately funded.
And so they operate on really 2 principles: volunteer capacity and funding capacity. So I think that all free clinics are looking at how do we expand both of those.
The growing concern has AmeriCare's looking at other needs in other communities. On the scene in Bridgeport, Jocelyn Momenta, News 8.